Hi, I'm Dr. Barry Ginsburg. I want to welcome you to our spring seminar. As you know, spring is the tip-off to our lipo season. Everybody's trying to get ready for the bathing suits in the summer. So thanks again for coming. What I'm going to talk about today is a little bit of the history of liposuction and exactly the ins and outs of what liposuction is and what a procedure is. And then after I'm finished with the introduction, then we'll bring everybody back into private rooms and we'll do consultations. Feel free to answer any questions you want now. If it's a more private question, we can answer it during your consultation. First of all, the procedure I perform is called Smartlipo. And there's no such a thing as stupid lipo, you know, everybody, what's so smart about Smartlipo? But Smartlipo was a term coined by Cynosure. And what it is the performing of laser skin tightening in conjunction with liposuction surgery. I started doing liposuction in the mid-1990s using the tumescent technique, which is invented by Dr. Jeffrey Klein in California. What that allowed us to do was it allowed us to perform liposuction under local anesthesia. There is no putting people to sleep, which avoids the dangers and risks of general anesthesia. The recovery is virtually immediate. People can return to work and exercise generally within 24 hours. I got my initial training from Dr. Klein and subsequently have attended many seminars and performed several thousand procedures. One of the most important parts about liposuction procedure under local anesthesia is the administration of the local, and I have a nurse who is dedicated, and that's the only thing that she does, and she also has administered the local anesthesia to several thousand patients. What I'm going to do is go over some pictures and then we can answer general questions here, and as I said before, we'll go into the room and do consultations. What's beautiful about this procedure is not only that we can make it pain-free, but you will be able to see dramatic results literally immediately. What we do is, during the consultation, we'll point out the areas that trouble you the most, and I will be able to explain to you what's achievable in one treatment session. This is an example of liposuction that I performed on this woman's neck, and this is a picture 6 weeks later. When we do a neck, which is a very popular area to do, it really changes the appearance of the entire face. It's a little bit of an illusion, but it actually makes the face look thinner by simply removing the fat. There are no major incisions, there is no stitches, and the only, quote, downtime is that you have to wear a chin strap for 3 days after the procedure. The skin will literally adhere to the muscles of the neck, giving a very sharp angle to the jaw, a much more youthful, attractive appearance. It's one of the most popular areas that I do because everybody sees your face, everybody sees your neck, and it's also one of the things that make us look older, and many people are very self-conscious about the way their neck looks and feels. This is a gentleman that I performed on, and he also subsequently lost several pounds. I think he lost 20 or 30 pounds. The actual amount of fat that's removed might only weigh about 5 pounds, but if you wanted to lose weight to achieve this result, you would probably have to lose about 40 to 50 pounds. Liposuction is not a substitute for weight loss. It is a way of removing localized pockets of fat. As you see, one of my favorite areas also is the love handles. Many women, because they don't see themselves from the back, are unaware of the way that their waist looks from the back. And I think one of the most attractive features about a woman is the long, narrow waist leading into a shapely backside. And by removing the fat above the backside, we can achieve those results very simply. Same thing with the back. Women hate what they call bra fat. So by doing liposuction, especially with the laser in this case, we can get that skin to tighten down and lay fat, and that's the picture the next day after the procedure. Age is not a factor. This woman was in her 60s. I performed 2 procedures to reduce from there to there. As you can see, you don't have to be overweight to need liposuction. This woman, even though she's probably at or near her ideal body weight, because of genetics, she accumulated excess fat in the love handles and the outer thighs. And this is the picture the next day. By performing liposuction there, we've been able to give her a very attractive appearing figure. Some women have had a tummy tuck, and although a tummy tuck can flatten the stomach, what results also is pushing out of the love handles. So I did not perform the tummy tuck, but I did the liposuction on her love handles and also did her neck, and this is the picture one day later. Some other before and afters. We see flattening of the stomach and lessening of the hips. When you have a bulging above the belly button, it also makes the breasts appear smaller because they're starting off at a higher point. So by removing the fat from the upper abdomen, it actually makes the appearance of the breasts prettier. Removing fat, once again, this woman has no backside. Her backside literally blends with her lower back. So by giving her that long, narrow, shapely waist, we're also able to give her a pretty backside, whereas the liposuction, actually, I never even touched her backside. And that's also a picture the next day. Some other examples before and after. Some people require more than one procedure. This woman actually had 3 procedures and lost 50 pounds by the time her 3rd procedure finished, and we were able to go from here to there in her. It takes a dedicated patient. You can't just have your liposuction and go back to your old lifestyle and habits. Most people who have liposuction are willing to spend the time and the energy with proper diet and exercise. One of the problems people face before they come to me is the fact that they have tried and tried again to lose weight and get a good figure, but frequently when you lose weight, the weight does not come off from the areas that you want it to. And sometimes, especially if you have a lot of fat in the abdomen, all that happens is the fat falls down and it actually looks worse. By suctioning out the fat and using the Smartlipo laser, we get that skin to retract. The collagen, the scar tissue, causes the skin to retract, and we're able to get a flat stomach in most people. This is a classic example of liposuction on the neck. This was taken probably 3 weeks post-op. Her entire face looks different. There is no weight loss between this picture and this picture. All we're seeing is the illusion of sharper cheekbones, a sharp jaw. She looks younger and prettier, although the pictures are very close together in time. We do all shapes and sizes. Wherever there's excess fat, I can remove it with liposuction. Another example of a sharper jawline. I hope I've been able to answer all your questions. Once again, I'm Dr. Barry Ginsburg, and thank you for attending our spring Smart Laser Lipo seminar. Thank you.